The World Health Organization has declared the 2009 H1N1 flu pandemic officially over. Although 50 million Americans were sickened by the virus, it was much milder than it had been predicted. The question now is, what have we learned from this pandemic? NJN News health and medical correspondent Sarah Lee Kessler looks for answers here in New Jersey.
16 months ago, when the frightening images from Mexico started pouring in and the death toll there reached 160, the CDC and federal health officials sprang into action, urging states to plan and prepare for what the WHO would soon call a pandemic. New Jersey was quick to respond to the threat posed by H1N1, a novel flu virus.
What we are in is the proactive surveillance and monitoring effort, one that we had planned for.
So in the ensuing months, state health officials held planning summits to map out a battle strategy.
All the partners that we brought together in our 6 summits over the summer were really key to making sure that we had the right response, and I think we did have the right response.
That response included promoting proper hand washing and other infection control guidelines. It also included following CDC vaccine distribution priorities. Pregnant women, young people, and the chronically ill would be first up when the vaccine arrived in the fall, but there were production delays, and when the vaccine finally rolled out, there were nationwide distribution problems that triggered long lines, discontent, and criticism here in New Jersey.
I had some of my pulmonary specialists telling me that they could not get the vaccine to give to their high-risk lung disease patients.
And we were out there getting the word out of how important these vaccines were, and then people couldn't find them.
1, 2. State health officials had hoped that 50% of New Jerseyans would roll up their sleeves for a swine flu shot, but just 1 out of 4 opted to do so. Still, we were fortunate. The H1N1 flu strain turned out to be mild. There were just 42 deaths in New Jersey. Worldwide, less than 19,000, not the millions seen in previous pandemics, including the one in 1918. So was this flu pandemic overhyped?
It certainly was not overhyped. For sure, when we started, we didn't know what kind of flu this was going to be. And remember, compared to the Spanish flus in 1918, we now have vaccines. We now have antivirals.
What have we learned from the H1N1 pandemic?
This pandemic has reinforced our classic teachings for infection control. Vaccination, hand washing, avoidance of contact with symptomatic patients, those are the things that control the epidemic.
Sarah Lee Kessler, NJN News, Newark.